everyone. It's Alex at Wake Up to Wellness, and today I want to talk to you about how to talk to your doctor about supplements. There was a time when a medical doctor was someone that we absolutely deferred um, all of our responsibility for decision making about our health care to. But the landscape of wellness and healthcare has changed a great deal in the last few decades, and many of us now are combining alternative therapies or plant-based medicine with conventional medicine for everything from prevention to dealing with serious illnesses. And in that respect, deferring responsibility for our health care to one member of our practitioner team, being our MD, is no longer a viable way of approaching our health care. The unfortunate truth is that at this point in time, medical doctors are not receiving any significant training in alternative therapies or plant-based medicine. And so through no fault of their own, they're not in a position to offer expert opinion on these things. Now, you may be lucky enough to have found a medical doctor that is motivated to learn about and work in combination alternative medicine and conventional medicine. And if you are lucky enough to have found a medical doctor like that, I suggest that you hang on to them because they're worth their weight in gold. But the truth is, most of us have to put together a team of different individuals with different expertise, and may include a naturopath, may include a massage therapist, an acupuncturist, may include your yoga teacher, may include and will include your medical doctor. And at the very head of that wellness team, of course, is you, the person that is ultimately responsible for making all the decisions. Once you've gleaned the best information and the best advice you can from all the experts around you, at the end of the day, we have to make decisions about our own health. And that applies to smart supplementation as well. So under the old paradigm, we would go to our physician and we would say, "Doctor, I've decided, based on the research that I've done and the testimonials that I've heard, that I'm going to be including this supplement in my plan to support my body, to support regeneration of my cells and repair of my DNA, and I am really excited about including this in my health care." But under the old paradigm, we would say, "But I want you to give me the okay. So you read this list of ingredients and you tell me if it's okay." The sad fact is that if your doctor looked at this list of ingredients and if they didn't understand what they were, how they worked together, much less how they worked with your prescription drugs, they're just going to tell you, "No, I'm sorry, you can't take that supplement." Okay, a lot of us are not willing to live within a paradigm like that anymore. So the new paradigm, the new way of working with our doctors, is to go to our doctors and to say, "Doctor, I am very motivated to be an excellent patient. I am really motivated to take charge of my health, to be responsible for my health, and I am working diligently to make lifestyle changes. I'm changing my diet. I'm bringing in more exercise. I'm going to my yoga class, and I am using smart supplementation. I've done lots of research, and I am feeling great about taking this supplement. And what I want to ask of you, doctor, is if you would please work with me to monitor any appropriate areas of my health that you feel need to be monitored so that we can adjust my prescription drugs to adapt to this healthy lifestyle that I'm taking." And in fact, I've brought you a brochure that lists all the reasons why this is a great product and the ingredients on the back. And if you have any concerns about these ingredients based on your knowledge, I would so appreciate it if you would take a phone call with my naturopathic doctor. And he's agreed to consult with you to help me have the best health care that I can. Would you be willing to do that for me, my beloved doctor? And hopefully your doctor on the inside is just cheering inside for your for your level of enthusiasm for your health care, and for basically letting them off the hook of having to know everything under the sun about every aspect of health, so that they can just focus on what they know best. So you're going to leave that information with your doctor, and I'm going to give you an example of blood thinners just to make this a little bit more concrete. So a shocking number of older people are on blood thinners now, and their doctors are giving them advice, in some cases, telling older people not to eat salad because salad has a natural blood thinning effect, green leafy vegetables, and they are essentially asking the person to abandon healthy lifestyle habits in order to adapt to the prescription drug. And this just has a cascade of detrimental effects on a person. So in this new way of working with your doctor, if you're on a blood thinner, you would go to the doctor and you would say, "Doctor, for all these reasons, I have decided that I'm going to be taking a supplement, and I would like you to work with me to adjust my medication to suit my healthy lifestyle." Do you understand the difference? Ask your doctor to adjust your medication to adapt to your healthy lifestyle, not the other way around. And then, not only will you be taking the appropriate amount of your prescription drug, carefully monitored by your doctor for use with your supplements, but you will also potentially, under their guidance and recommendation, be able to lower the dose of a prescription drug that you're on. Because if you're getting relief of symptoms from a natural product, if it's giving an add value in that sense, you may be able to take less of fill in the blank. Of course, under the recommendation and monitoring of your doctor. But not only that, you'll be able to keep having all the positive benefit of the supplement, of the lifestyle, of the salad, of the exercise that you want to be incorporating into your life. And it's a win-win situation all around. Just to give you encouragement, I want to share a story that Stephen Chernisky, our Chief Scientific Officer for Univera, was at a medical convention with conventional medical physicians, and he talked about this new way, this new empowered patient who is going to be bringing this attitude to their doctors, and that we're teaching this and we're encouraging this within our wellness community of Univera. And he received a standing ovation from physicians. So I hope that that story encourages you to take a more empowered role when communicating with your doctor. And I encourage you to send any questions you might have to me via email, and I'll be happy to answer them. Have a great day.